Hello, my name is Dr. Shazad. I'm an interventional gastroenterologist and former associate program director of a GI fellowship at the Brooklyn Hospital Center. Today we have our guest, Dr. Jamil Shah. Dr. Jamil Shah has completed his interventional gastroenterology fellowship at Rutgers University. Now he is going to be attending from July 1st to Brooklyn Hospital Center, and we wish him best of luck.
Oh, thank you.
Dr. Jamil Shah, we are doing this video series for our foreign medical grads and all other residency candidates to help them improve and increase their chances to get into residency program. So my first question to you is, what do you suggest the residency candidates, what are the mistakes they should avoid when they were called for interview?
Yeah, I would say, some of the things that, I have seen is that, the applicant is not aware of all the specifics of the program. So, as an interviewee, all the programs may seem very similar, but it's important to understand, what the specifics are about the program, whether it's an academic or community program, whether it's a city hospital versus a rural or suburban hospital, the types of applicants that they are trying to select. All these things can go a long way in terms of helping you to interview and perhaps get a position in that program. So it's always important to study the program. Every program has a website that has information about the program, and that will also help you ask good questions when it's time to interview, so that it looks like you understand all those details.
So, for example, if you are in a major city program, where, for example, New York City, you are actually going to deal with a multicultural patient population. So you basically, when you come in, you should learn about those cultures. Like, for example, there are South Asian population here, Spanish population, and American patients, African Americans and Caucasians. So at least you should ask one of the senior resident to what they should know, what are the resources they can find to learn about cultural competency. And that you can also mention in interview, that you have learn about cultural competency to the program. That will also positive point in your interview.
Yeah, that is very true, exactly.
Yeah. And what do you think when foreign grads coming in the country, and what they should be prepared from their home country before they come here?
I think it's important to have all of the documentation and letters lined up, because it can be difficult to go back and forth if you're in the U.S. already, doing observerships or different research, and then to have to collect all the information back home. Deadlines are approaching, and all those things to have in place, so that when you're ready to apply, all of those things are there. I think that is also helpful. I would say those things are important. And also, touching on the earlier question, Dr. Shazad, I think one of the things that I see frequently is that the applicants are always, they sound sometimes rehearsed, a very prepared answer. And then if you get a question you're not expecting, then you get flustered because you're not prepared to answer that question. So it's good to be flexible, have an idea of how you want to answer the question, and then when you get a question, you can change your response to fit the question, rather than having a very, very specific answer. And then if you get a question that's a little bit different, then you have difficulty answering it. So always good to be flexible and have an idea of how you want to answer everything, and then you'll sound more comfortable and less anxious during the interview.
Yeah. And I think the second question which I ask, I would like to add some more into it to help our candidates, that when you coming from your home country, whether it's India, Pakistan, Bangladesh, Nepal, and any country, I believe you should contact the organizations of their respective countries. For example, we have APNA here, which belongs to Pakistani diaspora, and we have API here, which belongs to Indian diaspora. We have a Bangladeshi association also. So you should at least email them that you are coming America, and would you kindly give us some names of the physicians which you can contact for the observership or for further mentorship. That will really help you a lot. So when you're landing, you're ready to go. You're not wasting your time, because time is money and it's limited, right, Dr. Shah?
Yeah, I agree 100%.
Yeah. And the other things in interview, there are a couple of things I have seen as an associate program director also. Your presentation, you should be dressed well. Your dress should not be like too bright or too mellow. It should be even though you are on a Zoom these days, but your presentation is very, very important. And your background should be very nice, and of the Zoom background should be very nice. I would say keep it very simple. You don't have to put like roses behind you or some kind of like animal pictures behind you. No, you should be like maybe a white background. That will not distract to other people who are interviewing you, and will not be thinking something else in their mind, or they should be focusing on you, not your background. That's one thing. And you should be well dressed still, obviously. If you think that, oh, they're going to see half as, no, what if your camera moves? So what are you going to, that interview you lost, right? So you should be prepared, you should be well dressed. And that also, even though somebody not looking at your whole picture, but you are looking at yourself. That's important. When you are happy, then other person will be happy too. And this makes this goes by both ways. And the other thing I've saw in the students and residency candidates are you come off, you are off, or you are scared, or you are shy, so you're not open to interview. You are more passive. I think you should be more active in an interview, and you should be happy that someone is looking at you. They want to bring you their own home, so you should be more vibrant and more open to the interview. And when you ask the question, exactly answer that question. And I would not advise you to go go on and on and on. That will be not good thing. But you should be very vibrant, very smiley, and you have you should not be moving on the chair, or you should not be doing this, or your hand should not be like this. It's distraction. So I don't think this is a good thing. So I hope you understand. And don't also look like a bossy also, or don't have arrogant feelings too. Even some people have a good scores, they come off good background, and but it's still humbleness and kindness goes a long way. So be vibrant, active, proactive, and not arrogant. Eye contact is very important. When I came in this country, for me eye contact was not important, because it was not culturally for me from coming that country. If I don't eye contact in Pakistan to somebody I'm talking to, that doesn't mean I'm lying or saying something. But in America, it's very important. eye contact not only in an interview, but it's in your daily life. Eye contact with your patients, because that gives patient a confidence to trust you. And also, same as the interviewee who's interviewing you has to give you like a good vibe that, oh, you're not. But you don't have to eye contact like this. Obviously, there should be like a pause in eye contact, and then pause in eye contact like that. So I think that's the main thing. Thank you so much for today. We discuss and we focus on interview, and we focus on some preparation. In my next video, I will have a more better preparation for you, and basically in the next interview I would like to advise for those who have either low score or their graduation years are higher than program can accept, and some other pitfalls. So I will have a good advice for you to improve your chances to get into the residency program. Thank you.